My name is Mick Kelly and I'm an orthopedic surgeon here at Orthopaedic Associates of Wisconsin. I'm originally from Wisconsin and always wanted to come back to the state. I did my undergraduate and medical training in Madison, and then I did orthopedic surgery training in Chicago at Rush University Medical Center. I had the opportunity to train with some of the pioneers in the field of hip and knee replacement, and that sparked an interest in the career for myself. I think I have one of the best jobs in the world because hip and knee replacement are two of the most effective surgeries in all of medicine. And it's really an exciting time right now in joint replacement because we're finally starting to incorporate technology with surgery. Orthopedics, in my mind, is all about restoring function and improving quality of life for patients. So one of the most rewarding things for me is to speak to a patient in clinic and they're just frustrated because they can't do the things that they really want to do in life, and take them through the process of surgery, and only a few weeks later they come into clinic with a totally new perspective on life. I tend to take a conservative approach to treating patients. I think it's very important to exhaust the non-operative treatment measures because those are the safest. And it turns out that those work for most of the patients. My approach to patient care is influenced by an experience that I had with my family. During my final year of training, my father actually underwent a total hip replacement, and this gave me a completely different point of view from a patient's perspective. And more than anything, I think I appreciated the significance of that event in my father's life. And so I try to remember that every day and treat my patients as though they're one of my family members.